Guys, in this video, let us understand splint. Basically, splint is for immobilization, right? So, common splints that you use at the site of the fracture, at the accident site, you can keep a folded newspaper or a pillow, or you can keep a wooden plank or a bamboo stick or an umbrella, right? So, this is splint. So, just to immobilize. And there is some sling also which they have included here. So, basically, you want to immobilize. That is a splint. Look at this one here. This is a little more professional kind of a thing. Look at this. Kramer wire splint. Okay. This and all. Then Thomas splint. And then you have Bowler bronze splint. This is an inflatable splint. Right. Inflatable they have shown here. Then they have shown a head halter sling. So many types of splints. Sorry, what I'm saying. Splints are there. Under splints only they have included slings also. So they are basically, they can be used so that you can temporarily transfer the person. For that you can use, or as a treatment itself they can use splint. Okay. What else? They are not only used in fractures, they are used in other orthopedic conditions also, like infection, congenital dislocation of hip, etc. So not just fracture, they can be used in congenital dislocation of hip, etc. You would have seen this in, wait, let me show you. So they are using these type of splints. Dennis Brown bar they are calling it as it is. Lot of things are there here. This is Thomas splint. You can see here the ring through which they will put the leg, right? And this will how it will be, no? You put your leg inside this. This is your body here. This is your body here. You put the leg inside it, okay? This is the knee. So this is how you use the Thomas splint. And then there will be some traction also that you will give. And then you have seen the Bowler bronze splint in which there is no ring, okay? But it doesn't have counter traction. So you can't use this Bowler bond for transport. Thomas splint you can use for transport. People, now let us go to surgical splints. Are you understanding? What are we moving to? Splints. S-P-L-I-N-T-S, splints. Under this we will look at surgical splints. Surgical splints. Okay? Fine. Focus. So, there are various methods of splinting the fracture surgically. Intramedullary splinting. Intramedullary splinting means they will use a nail. Inside the bone they will put the nail. Okay, very, very interesting technique actually. Inside the bone, you can see only with X-ray looks like. See, this is the bone, okay, this is our beautiful bone. Inside the bone, they are going to put a metal rod. Intramedullary nail it is. This is intramedullary splinting. Okay, so a different way of immobilizing. Okay, in long bones only they will do obviously, especially for femur. That's the longest bone. So here you can see that intramedullary nail. Can you see this? This one. Intramedullary splinting. Now look at the extramedullary. See, this is outside the medulla. This is outside the bone, but inside your body only still. So this is internal fixation only, right? They are splinted with a plate and screw. Okay. Then external fixation. Outside the body you have the kind of a, what do you call this? Like the plate, but this is outside the skin. Okay. Only these pins are going inside the bone. Okay. That is external fixation. So you should understand, where is the skin? The skin is here. Outside the skin you have those fixator, external fixator. Extramedullary splinting, we told you, you'll apply the plate where? On the surface of the bone. So outside the bone. This plate without producing compression. If it is not producing compression, a neutralization plate. There is something else called as buttressing plate. Neutralization plate without producing compression, if it is without compression. Buttressing plate. Buttressing, they are saying it is actually not fixing. It's not really fixing. Okay. See, this curve you can see of the tibia. That's what they are talking about. For fixing tibial condyle fractures, buttressing. So it's a curved plate, is it? Look at this combination of compression and splinting. So here you can see the compression screws, they are trying to bring it together, right? So this is a combination of compression and splinting. So people, in this video you looked at splinting, you looked at very common splints like newspaper, rolled up newspaper or umbrella, etc. Then you saw some special splints like Thomas splint, Bowler bronze splint and everything. Then Kramer wire something, right? Then you saw the surgical splint like internal fixation, buttressing, external fixation. In internal you saw that intramedullary nail and all that.